Can Adrian Peterson really return to play 1 week after suffering a meniscus tear? Welcome to That's Gotta Hurt. I'm Dr. David Geier. All-pro, all-everything running back Adrian Peterson of the Minnesota Vikings injured his right knee Sunday night in a game against the Green Bay Packers. He was injured in the third quarter. He got his leg sort of caught up in one of the Green Bay linebackers, got his knee caught up and sort of twisted his knee. Now, he was examined on the field by the Vikings athletic trainers and team doctors, but it was obvious right away he was having trouble putting weight on it. So they took him to the locker room. Now, a lot's been made of the way he got to the locker room. Remember, Minnesota in that game was launching its new football stadium, and they built it where there's a field club level. Basically, fans have access, premium access to the players. Unfortunately, that's how the team had to get him to the locker room. You can see video on NBC where basically, the athletic trainers were carrying Adrian Peterson where spectators could watch him. I mean, if you're trying to make that much money, and I get this, age of trying to make a lot of money and increase access to fans willing to pay for it, but I mean, what's next? You have an injured player and they get to take selfies with him? I mean, come on, Minnesota, this is a little much. But he finally gets to the locker room and was quickly ruled out. After the game, he was seen walking around on crutches, still obviously in a lot of discomfort. Now, head coach Mike Zimmer said that it calmed down a fair amount after the game, but he'd get an MRI the next morning. That MRI, unfortunately, showed a meniscus tear. Now, the team is saying he potentially could return to play this coming week against the Carolina Panthers. That would be 1 week after suffering a meniscus tear. Is that really possible? Well, the meniscus, just to let you know what that is, that's a C-shaped shock absorber. You have one on either side of each knee, one on the medial side, or the side closest to the midline of your body, and one on the outside, the lateral meniscus. So you have one on each side, and it's a shock absorber between the thigh bone and the shin bone, commonly torn with twisting motion. So that makes sense that potentially would be the structure damage. Now, the problem with the meniscus tear is that it hurts. You try to plant your foot, you try to turn, and it just hurts. That's why this is probably the most common operation that we do in orthopedic surgery, or certainly one of the most common, because an active person or an athlete with a meniscus tear very often can't do the sports or the exercise, can't do the movements that person wants to do. And non-operative treatments like injections and braces and all these different types of things usually don't help to decrease that pain when that tear of the meniscus catches between the bones with sports activities, so they undergo surgery. Just so you know, before we get back to Adrian Peterson, there's two types of ways that we surgically treat meniscus tears. The vast majority of meniscus tears, I'd guess somewhere around 85% of them, are the type that the surgeon goes in and trims out the inner part of the meniscus that's torn. You leave the stable part in to serve as a shock absorber, but yes, you're trimming out some of the meniscus to eliminate symptoms. Does that have risks long term? Potentially, but short term, you can get back to play really quickly. Sometimes we've seen players get back in as little as 3 to 6 weeks, even though you continue to improve for months. Now, a small portion of meniscus tears are the type that you can sew back together with stitches. That's great because you preserve all of the shock absorber, but the recovery is a lot longer. The surgeon and the therapist have to go a lot slower with the rehab, limit stress on the stitches while that meniscus is healing, and that process can take 4 to 6 months. This is what Russell Westbrook and Derrick Rose in the NBA had, and why their recoveries were so long. Here's the trick in trying to predict how long Adrian Peterson would be out. MRIs are notoriously bad for predicting if a meniscus tear is the type you can sew back together or just needs to be trimmed out. It's really good for showing you yes or no, there's not a tear, but not really good at predicting what the surgeon's going to do. That's something the surgeon really only can tell looking at it through the scope and using a probe to pull on it. So that would be a decision. If it's repairable, potentially they make that decision at the time of surgery, but that would actually have long-term recovery recovery factors and disappoint a lot of Vikings fans and fantasy football fans. But it's good if you can repair a meniscus because you save that shock absorber and potentially prevent long-term degenerative changes in the 3, 5 years, 10 years down the road. Now, if it's the type, and again, this gets back to the most likely scenario, that you just trim part of it out, the recovery, you're not waiting on something to heal, so the recovery is pretty quickly. Generally, like I said, we see people get back in about 3 to 4 weeks. It's not that you couldn't get back sooner, but the knee's swollen, it's stiff, the muscles are weak after surgery, so it's really hard. Players are certainly not at 100%, and there is some thought that that repetitive impact would actually set the recovery back. So my guess is if an athlete went back to play right after that surgery, 4, 5, 6 days later, I would advise as a team doctor, don't try to play right after that. Maybe give it 3 to 4 weeks, get the swelling down, get the motion better, get the strength better, try it out with jogging and see how it goes. Now, we've seen Adrian Peterson get back after major surgery, certainly much bigger than a meniscus tear, and do really well. He had ACL reconstruction and MCL surgery and got back to play in 9 months and had an amazing season when he got back. So we know he could do it, but 1 week seems a little optimistic, quite honestly. Now, the other interesting part about this is, could he actually play through it? If it's the type of meniscus tear, and this is pretty rare, but it can happen, where the meniscus is flipped into the center of the knee, what we call a bucket handle meniscus tear, the knee locks up and you can't really play through it, plus you potentially risk making that worse. But again, the majority of the meniscus tears, it's really more pain that's the issue, so it is possible in theory to try to play through it, get the symptoms better, you get the swelling and the pain under control, and try to play through it. You're not at 100%, but in theory, that's possible. So what, basically the doctors, the athletic trainers, coaches would be looking for with Adrian Peterson is, how much does this bother him, and is this something that, having him try to play through it now is better than having surgery and having him back in 3 or 4 weeks? That's going to be the critical question in the coming days. Without being involved in his care and without knowing, just doing hundreds of meniscus surgeries every year, what you typically see with patients is they can't do what they want to do. There aren't that many good non-operative treatment options, so they end up going through surgery. And again, if it's the trimming out type, they're back in about 3 to 4 weeks, but again, continue to improve over 6, 8 weeks, and sometimes months. Okay, what do you think about that? I'm curious what you think. Thank you for watching That's Gotta Hurt with Dr. David Geier. Tomorrow on the show, we're going to basically do a very quick weekly roundup of injuries that have occurred in the NFL. We might do some Major League Baseball as well. So if you have athletes and injuries that you want me to discuss, leave those in the comments below and I'll try to get to those tomorrow. Thursday, I think we have something a little fun as well. If you like this show, That's Gotta Hurt with Dr. David Geier, please subscribe to my YouTube channel. Click the box in the upper right of my YouTube channel, and you'll get these episodes delivered directly to you. Thank you for watching, and I look forward to seeing you tomorrow.